Apligraf is a sophisticated tissue-engineered composite skin equivalent made of allogenic male newborn fibroblasts and keratinocytes that closely match the standard structure of human skin. In contrast, the epidermal layer is generated by human keratinocytes and has a well-differentiated stratum corneum lattice. Apligraf contains the matrix proteins and cytokines that are present in human skin. Langerhans cells, melanocytes, macrophages, lymphocytes, blood arteries, or hair follicles are absent from Apligraf. The fibroblast and keratinocyte cell banks, the cell from which Apligraf is derived, are examined from the presence of human and animal retroviruses, bacteria, fungus, yeast, mycoplasma, cardiology, isoenzymes, and tumorigenicity. Testing the finished products include the examinations of morphology, cell viability, epidermal coverage, sterility, mycoplasma, and physical container integrity. Reagents obtained from animal products such as bovine pituitary extract are also used to produce goods. Before usage, all materials produced from animals are examined for retroviruses, bacteria, fungi, yeast, and mycoplasma, and all bovine material is sourced from nations free of the BSE. The absence of Langerhans cells in Apligraf is assumed to cause its immunological inertness. At the same time, it was demonstrated that the substance did not last over time in deep dermal wound model but rather served as a transient biological dressing that gave the wound growth factors. To treat non-infected partial and complete thickness skin ulcers caused by venous insufficiency lasting more than 1 month and that have not sufficiently reacted to traditional ulcer therapy, Apligraf is advised in conjunction with routine therapeutic compression. Also, some things could be improved in using Apligraf. First, the use of Apligraf in clinically infected wounds is not advised. Second, patients with known bovine collagen allergies should not get Apligraf. Lastly, patients with a history of known hypersensitivity to the ingredients of the Apligraf agarose shipping medium should not receive Apligraf.
Apligraf is a skin substitute made from type 1 bovine collagen matrix. This treatment carries very little risk since it is non-intrusive. Apligraf is able to promote healing due to its engineered structure, which contains living keratinocytes, stem cells, and living fibroblasts at its inner layer. It heals wounds that resisted healing from any traditional wound treatments. Also, using Apligraf can lower healthcare costs and decrease the time spent in the hospital by reducing the healing time for the wound. More importantly, the use of Apligraf has contributed to the reduction of amputation due to skin ulcers.
Apligraf is authorized for the treatment of non-infected partial and a non-thickness ulcer caused by the venous deficiency lasting more than 1 month, as well as the full-thickness diabetic ulcer lasting at least 3 weeks. It is not for the exposed tendon, muscle, capsule, or bone. In a recent study, the patient who used aggressive sharp debridement with uploading, while the 112 of patients additionally received Apligraf versus cynomycin gauze. The patient who was treated with the Apligraf completed the healing to 56%, whereas the standard healing means only reached 37%. Apligraf is also studied with a common plant used for negative pressure wound therapy. It's also a bioengineered tissue that has been found to be both safe and effective in the treatment of diabetic chronic wounds. It also shown to decrease healing time, which should be more cost-effective than standard wound therapy.
Did you know that Apligraf can be an alternative to skin grafting in the pediatric population? Before Apligraf, split thickness skin grafting and healing by secondary intention are the most common options for treating of full thickness skin injuries. This case explores Apligraf as an alternative treatment for full thickness skin injury in the pediatric population. Apligraf, a bioengineered living cell constructed, is an advanced wound care modality that is commonly used to treat chronic, non-healing venous leg ulcers (VLU) and diabetic foot ulcers (DFU. This case demonstrates Apligraf as a viable, if not superior, treatment option for full-thickness skin injury. Bioengineered living cell constructs, or BLCC, like Apligraf, are approved by Food and Drug Administration (FDA) for the treatment of chronic VLU and DFU. Apligraf is a living bilayered skin substitute formed by a human neonatal foreskin derived keratinocytes and fibroblasts in a bovine type 1 collagen lattice. Studies looking into the mechanism of action of BLCC have demonstrated that they are able to phenotypically convert chronic, non-healing wounds to a more acute inflammatory environment that can promote healing. This is achieved by inducing genes that are responsible for acute inflammation healing, stimulating wound edge keratinocytes, and attenuating beta-catenin. In the study, STSG is the treatment of choice for wounds such as in this case. There are few drawbacks. Autografts require the creation of donor site, adding an additional scar and recovery time. However, the other treatment option that was proposed to the family was healing by secondary intention. The downside to this approach was the possible development of a severe wound contracture and the functional implications this could have to the patient later in life. Despite the positive results surrounding the use of Apligraf, there are very limited studies and cases of its use in the pediatric population. Additional studies need to be conducted to fully compare the use of Apligraf versus the STSG and healing by secondary intention in pediatric patients. An additional consideration for providers and patients is considering the Apligraf's cost. According to the 2021 Medicare rates from Organogenesis website, Apligraf cost anywhere from approximately $870 up to $3,500 depending on the multiple factors. Apligraf is not currently covered by insurance outside of its FDA approved indications of VLU and DFU.
By helping to restore each of the skin's normal healing functions, Apligraf puts VLUs and DFUs back on its track to heal. In a study of mechanism of action, a single application of Apligraf transformed VLUs from chronic to acute, demonstrating in vivo that Apligraf stimulates a potent healing mechanism, helps to restore normal healing functions, and helps to correct and regulate pro-healing growth factors signaling pathways. Apligraf is backed by extensive, reliable, clinical and real-world evidence in both VLUs and DFUs. In the real-world setting, studies show that Apligraf flows more VLUs and DFUs significantly faster than other products on the market, with reliable evidence, innovative technology, outstanding coverage. The healing power of Apligraf is something that is on par of its time. Although Apligraf does not directly restore the skin, however, it transiently protects and provides injured skin with scaffold and signaling molecules produced by itself within the skin. Which fosters and accelerates skin regeneration. With that said, Apligraf is undeniably one of the innovations that will lead us to the next step in biotechnology, specifically in tissue engineering and regenerative medicine.